median nerve. It is the chief nerve of the anterior compartment of forearm or flexor compartment of forearm. It is also known as laborer's nerve. It arises from both medial and lateral cord of brachial plexus. Root value: anterior primary rami of C5, C6, C7, C8 and T1 spinal nerves. Important clinical relations. In the axilla, this is the third part of the axillary artery. This is the medial root of median nerve. This is the lateral root of median nerve. In the axilla, the medial root of the median nerve crosses the third part of the axillary anteriorly to join the lateral root of the median nerve to form the median nerve. It lies lateral to the third part of the axillary artery, or it descends lateral to the third part of the axillary artery. In the arm, see, upper part of the arm at the insertion of coracobrachialis, lower part of the arm. In the upper part of the arm, the nerve lies lateral to the brachial artery. The nerve lies lateral to the brachial artery. At the insertion of coracobrachialis or middle of the arm, it crosses the brachial artery anteriorly from lateral to medial. Lower part of the arm, it descends on the medial side of the brachial artery. In the cubital fossa, see, this is the tendon of biceps and this is the bicipital aponeurosis. This is the brachial artery and this is the median nerve. So the median, in the cubital fossa, the median nerve lies medial to the tendon of biceps and brachial artery. It is protected from the superficial structures by the bicipital aponeurosis, this facial extension. So, tendon, artery, nerve, TAN relation, you can easily remember. In the forearm, it enters the forearm from the cubital fossa, it enters the forearm by passing between the two heads of pronator teres. So, it enters the forearm by piercing or passing between the two heads of pronator teres. Then, in the forearm, it descends between flexor digitorum superficialis and flexor digitorum profundus. You have two muscles, okay, flexor digitorum superficialis. If you take that muscle, you can see the flexor digitorum profundus. So it descends between the flexor digitorum superficialis and flexor digitorum profundus. At the wrist joint, it runs deep to flexor retinaculum. There is a tunnel known as carpal tunnel formed by the flexor retinaculum through which the tendon of the flexor muscles and the median nerve runs. So, at the wrist joint, it runs deep to the flexor retinaculum, that is in the carpal tunnel. Then it enters the hand. In the hand, it divides into lateral and medial division. It divides into two divisions, lateral division and medial division, and ends by supplying the hand. Okay. Just below the flexor retinaculum, okay, it sends a recurrent branch. It sends a recurrent branch to the thenar muscles. To the thenar muscles. So this is the important clinical relations. Branches and distribution. In the axilla and the arm, no branches. Branches and distribution. Number one, articular branch. Articular branch to elbow joint, wrist joint. Number two, muscular branches. Okay. In the cubital fossa, it gives muscular branches to pronata teres, flexor carpi radialis, and palmaris longus. Okay. And one more muscle is flexor digitorum superficialis. So in the cubital fossa, it gives muscular branches to pronata teres, flexor carpi radialis, palmaris longus, and flexor digitorum superficialis. This is the superficial layer of flexor compartment. This is the middle layer of flexor compartment of forearm. In the cubital fossa, when the nerve is entering into the forearm between the two heads of pronata teres, it gives a deep branch which runs deep to the deep head of pronata teres. It is known as anterior interosseous nerve. Anterior interosseous nerve. It is the deep branch of median nerve. It is the deep branch of median nerve. It runs between the interosseous membrane and the flexor digitorum profundus. It runs between the interosseous membrane and flexor digitorum profundus. Okay. It gives muscular branches to flexor digitorum profundus lateral half or lateral half of the muscle, flexor pollicis longus, and pronator quadratus. So, this is the superficial group of flexor compartment. This is the middle group of the flexor compartment, and this is the deep group of muscles present in the flexor compartment of forearm. Okay. In the hand, okay, it divides into lateral and medial division. Okay. A recurrent branch. The recurrent branch supplies the thenar muscles. There are 4 thenar muscles: flexor pollicis brevis, abductor pollicis brevis, opponens pollicis, adductor pollicis. Out of this, okay, the median nerve supplies flexor pollicis brevis, abductor pollicis brevis, and opponens pollicis. That is, except adductor pollicis, it supplies all the muscles of the thenar eminence. Okay. Cutaneous distribution. Okay. I told you the median nerve in the hand divides into lateral and medial division. So this supplies the skin over the lateral 3.5 fingers. 1, 2, 3.5, lateral 3.5 fingers, including the dorsal aspect of the terminal phalanges. Whereas the skin over the lateral half of the palm is supplied by a cutaneous nerve arising just 5 cm above the flexor retinaculum. 5 cm above the flexor retinaculum, a cutaneous branch arises that supplies the skin over the lateral half of the palm. Okay. The lateral and medial division present in the hand also supplies 2 muscles in the hand, that is, first and second lumbricals. That is, the lateral 2 lumbricals are supplied by the median nerve in the hand. So this is the branches and distribution of median nerve. Applied anatomy. Eighth thumb deformity. Okay. When the median nerve is compressed by the flexor retinaculum in the carpal tunnel. Okay. It is known as carpal tunnel syndrome. Okay. In this condition, the median nerve which runs deep to the flexor retinaculum is compressed. Okay. So what happens below the wrist? Okay, the nerve is paralyzed. The nerve is damaged. So it results in paralysis of the muscles supplied by the median nerve below this level, mainly the thenar muscles. Okay, the thenar muscles are affected except the adductor pollicis. So what happens? The thumb is laterally rotated and adducted. This condition is known as eighth thumb deformity. When the median nerve is affected in the forearm, affecting the branch to the flexor digitorum superficialis of the index finger. When you try to flex the fingers, all the three fingers flexes, resulting in loss of flexion of this index finger. This is known as pointing index deformity. Pointing index deformity. If the median nerve is damaged in the cubital fossa or upper part of the forearm, this results in the paralysis of flexor digitorum superficialis and flexor digitorum profundus, lateral half of the muscle. When the flexor digitorum superficialis is affected, it results in the loss of flexion of the middle phalanges. So the middle phalanges movement is lost. When the flexor digitorum profundus is affected, it results in the loss of flexion of terminal phalanges. Terminal phalanges, especially only the lateral two, because only the lateral half of the muscle is supplied by the median nerve. Regarding the cutaneous distribution, when the nerve is compressed in the flexor retinaculum, under the flexor retinaculum, loss of sensation over the palmar aspect of the lateral 3½ fingers, including the dorsal aspect of the terminal phalanges. Whereas the skin over the palm is not affected because it arises 5 cm above the flexor retinaculum. It arises from the median nerve 5 cm above the flexor retinaculum and supplies the skin over the palm. So when there is loss of sensation both in the palm as well as lateral 3½ fingers, the nerve is damaged in the cubital fossa or in the forearm or above the level. If it is below the flexor retinaculum, the lateral half of the palm, cutaneous innervation is not affected.